when coastal health funding is compared to the Fraser Health, why is this discrimination? You look at the population, you said yourself that the population of Surrey is increasing. It's going to be larger than Vancouver. They have more than 3,000 acute care beds, and we have only 634?
Well, we changed that. We're now doing 17,000 more in Fraser Health because that's where the demand is, and Fraser Health deserves those services.
Sometimes I think that you know everything what's happening in Surrey. Sometimes I feel there's no situational awareness. You don't know, you don't understand that people are really upset now. So what's happening with this Bill 36 kind of, is it a gag order for the doctors, or you're trying to remove the gatekeepers so foreign trained doctors can come in and work here?
That tells you what we're doing with internationally educated doctors. Bill 36 is what's called, is a regulation of health professionals. And there is no gag order in Bill 36. There is no change.
Minister, I, in closing, want to humbly request you to meet these 35 doctors and do something for Surrey Memorial Hospital. So, are these doctors will be punished in any way?
The Harjinder Thin Show.
Minister, good morning. Thank you very much for joining us today.
Good morning, Harjinder. How are you?
Very good. Thank you. Minister, what is your response to the open letter issued by the Surrey Memorial Hospital doctors? 35 of these doctors are saying that patients are dying preventable deaths in the hallways of Surrey Memorial Hospital. What would you like to say?
Well, on the issue of patients dying, Dr. Lee has responded on behalf of the Health Authority, and I think she's correct. But what is true is that things are very busy at Surrey Memorial Hospital, as they have been for a long time. Surrey only has one hospital. We're building a second one, and that's important. In addition, though, we're also improving significantly, working with doctors' primary care. What's happening at Surrey Memorial and other hospitals in Fraser Health right now is we're in discussions with hospitalists and with emergency room doctors to ensure that they get the support they need. This is true in Surrey, it's true in Langley. And we're going to do the same kind of work we did with doctors and nurses and work with them to find solutions to the issues that they're raising.
So are these doctors will be punished in any way?
Of course not.
So you think they are telling the truth?
No, I'm saying that it's important to have a discussion. You know, I was at the Surrey Board of Trade yesterday. I talked directly in front of the 150 people that were there with doctors in Surrey, talk to them about the issues, and my job is to work to make things better. We've done that in primary care. We've done that in surgeries, including at Surrey Memorial Hospital. We've done that on diagnostics. When people raise issues, we work together to resolve them, and that's what we're doing.
I was one of them sitting there listening to you, Minister, and the doctor sitting next to me was telling me that they don't have a cath lab at Surrey Memorial Hospital, and they need it. Why is the ministry not listening to them? They have requested time and again.
Well, in the case of, we're talking about a cardiac cath lab.
Cath lab neurology.
A cardiac cath lab is what the request is, right?
Mm-hmm.
And in BC, we have 5 cardiac cath labs, right? 1 in each health authority, so we don't have them at every hospital. In Fraser Health right now, we have one at Royal Columbian Hospital. In fact, we're investing to make it better, to both improve the quality of care and the amount of people that we can support. This is one of the issues that's raised around the Surrey Memorial Hospital. It's a different issue than the one in the emergency room, right? And so Surrey Memorial Hospital is an important hospital, and the reason we're building a second hospital in Surrey after a lot of delays in the past is because we want to relieve some of the pressure on Surrey Memorial Hospital and do more things there with respect to specialty care. So that's one of the issues that we look at, we're making significant investments in Surrey now. But it's not the only investment, the issue of cardiac care. We also have to provide better cancer care, and that's why we're building a new cancer center in Surrey. If you look at Surrey's population, you'll see that over the next 20 years, it's going to increase again.
Yeah, okay, well, that's a very good thing that you said. The population of Vancouver is 662,000, having access to 3,000 acute care beds. Surrey has a population of 568, and it has 634 beds. You can understand that. Talking about the cath lab from Boston Bar to Surrey, there's no cath lab.
Well, of course, there's a cath lab at Royal Columbian Hospital, which is the nearest hospital, of course, to Surrey Memorial Hospital. There's one in all of Fraser Health. There's one cath lab in Vancouver Coastal Health. There's one in Vancouver Island Health. So that's the context. The question is, if you're making more investments, where would an additional cath lab be put in place to meet demand? We're massively investing in Surrey. You know this. We're building the only community in BC that's getting a new hospital. We're doing a lot of replacement projects, is Surrey, for the very reasons you said. And you're making the argument that governments in the past should have built a second hospital in Surrey. Well, they didn't. In fact, they sold the land available. We're building a hospital. We're building a medical school. We're increasing primary care. We're adding urgent and primary care centers. That's what the people in Surrey want to hear. They want to see us improving services.
No, Minister, we understand that because the hospital is 3-4 years away, and people are dying right now in the hallways, the doctors are telling. And when Coastal Health funding is compared to the Fraser Health, why is this discrimination? You look at the population, you said yourself that the population of Surrey is increasing. It's going to be larger than Vancouver. They have more than 3,000 acute care beds, and we have only 634?
Well, first of all, Harjinder, we have a health care system that's not built on municipal boundaries. Second of all, we're doing exactly that. Before I became Minister of Health, you know this because we've talked about it before. They perform more MRI exams in Vancouver Coastal Health than Fraser Health, right? That's not a question of hospital. People say we built the hospitals there a while ago, that's why they're there. Fair enough. We were doing more MRI exams in Vancouver Coastal Health when I became Minister of Health and in Fraser Health. Well, we've changed that. We're now doing 17,000 more in Fraser Health because that's where the demand is, and Fraser Health deserves those services. We are investing in the Burnaby Hospital, a new hospital in Surrey, the Royal Columbian Hospital. We've added an emergency room in Abbotsford. We've added services at Langley and Peace Arch Hospital. The massive effort has been to respond to a historic injustice that was, frankly, a liberal injustice against the Fraser Health Authority. And we are taking the steps to do that. In long-term care in Surrey, Surrey's long-term care homes had the lowest staffing levels in BC under the Liberals. We've changed that. They now have right at the provincial average, as they should. So that's the approach I've taken, which is, as you know, to constantly and regularly invest in Surrey. And that's what we need to do to make up for what had happened in the past, which was unfair to Surrey. But that was another government at another time.
On this new hospital, you're talking about 168-bed hospital. Can you please add a maternity ward in it? Because in this area, in Surrey, most of the babies, the maximum number of children are born in Surrey.
So, Harjinder, what we do when we build a hospital is we put the experts in healthcare and we say, what do we need? What we need at that second Surrey hospital, and including massive and significant emergency room capacity, which we're putting in place to relieve the very issue you raised, putting in new surgical capacity, 29,000 procedures in a year, and a new cancer center. You heard me yesterday talk about the future of Surrey, which is that we're going to see a 239% increase in people over 80. That means we need to invest in cancer services. So when the people at Fraser Health looked at that, they said, what do we need in Surrey? We need a second cancer center. And when we build that, it'll be the only community with 2 cancer centers. Why? Because we're going to see an increase in people in their 60s and 70s and 80s. We need more cancer care in Surrey, and that's why we're building a new cancer center there, while we're supporting maternity care all over Fraser Health, at Peace Arch, at Langley, at Surrey Memorial Hospital, in all those places.
Sometimes I think that you know everything what's happening in Surrey. Sometimes I feel there's no situational awareness. You don't know, you don't understand that people are really upset now. So what's happening with this Bill 36 kind of, is it a gag order for the doctors, or you're trying to remove the gatekeepers so foreign trained doctors can come in and work here?
Well, those are two issues. We're making significant changes to make it easier for foreign trained doctors. You've seen that in the last year in the improvements in the number of doctors. In BC, we added significantly to family doctors. In Alberta, they lost family doctors. BC, we added nurses. In Alberta, they lost nurses. That tells you what we're doing with internationally educated doctors. Bill 36 is what's called is a regulation of health professionals, and there is no gag order in Bill 36. There is no change. Health professionals are regulated now. It's the same as before, but what we have done is put in measures to ensure that patients are better protected and supported. And that's an important thing to do for every patient listening to us now.
Minister, I, in closing, want to humbly request you to meet these 35 doctors and do something for Surrey Hospital, because this discrimination of funding with this, Fraser Health being shortchanged, you must be fair. I mean, you're a fair person. Why don't you take a closer look and do something about us?
Harjinder, I just laid out the facts to you. Fraser Health had the worst treatment on diagnostic care and surgery. We've changed that in my mandate. But it does take a significant period to build a hospital and to make changes. It is true that in the period in which the population in Fraser Health grew substantially, the Liberal government was not investing in healthcare. And the result was it affected everyone in BC, but it really affected Fraser Health. And I've been taking steps, and I love Surrey, spend a lot of time in Surrey. I'm devoted to Surrey, and that's why we're investing more in Surrey than anywhere else. We're going to continue to do it for those reasons.
Yeah, but we can't keep on blaming Liberal government, forever. They did not perform. People kicked them out, brought you in, given you majority. People of Surrey given you majority. So now, make good use of it. Our police system is broken. Never mind, it's not department. Our health system is broken here.
Harjinder, we in Surrey, people in long-term care were worse than anywhere else. I changed that. People in diagnostic care were worse than anywhere else. I changed that. As a government, the NDP has invested in healthcare in Surrey. These are substantive facts. And so that's where we started, and that's where we're going. Yes, it takes a while to build a hospital in Surrey. We're building one. Yes, it takes a while to put a medical school in Surrey. We're building them. And both of those things should be there now. But previous governments took different decisions. Well, we're taking the right decisions. We're investing in Surrey, and I'm very proud of it.
Anything else you'd like to say in closing?
No, not at all, except that we got to continue to work together. It takes a whole community to build a new hospital and to solve these problems. And that's why I'm working with doctors and nurses and health sciences professionals and healthcare workers every day to do it. A lot of our healthcare workers don't just work in Surrey. They live in Surrey. And they know, and I know, that we have to take steps together to make things better.
Yesterday, among those people who were asking you questions, the head of the emergency department and director of the cardiology, Dr. Young, they were there. Are you going to meet those people ever?
First of all, I meet with doctors all the time. And I saw them yesterday, right? And so I engage with people all the time. And we had an open public exchange yesterday. I thought that was a really good event where I came and talked about the priority we're giving Surrey. And they talked about the things that we need to do in addition to those priorities. And I'm always listening, Harjinder.
Please accept my sincere thanks that, in spite of all these problems that I'm trying to bring it to your attention, you still keep coming. Thank you for the access.
Of course, and always. And I'm going to be in Surrey lots because that's where we need to make the most investments, and that's what we're doing. Sometimes change is slower than we'd like, but it's coming, and we're building, and that's the important thing.
Minister, thank you.
Hey, take care, Harjinder.
Bye-bye. Health Minister Adrian Dix ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸਨ। ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਇਹੀ ਪੁੱਛ ਰਿਹਾ ਸਾਂ ਕਿ ਜਿਹੜੀ 35 ਡਾਕਟਰਾਂ ਨੇ ਸਰੀ ਹਸਪੀਟਲ ਦੇ 35 ਡਾਕਟਰਾਂ ਨੇ ਐਮਰਜੈਂਸੀ ਵਾਰਡ ਤੋਂ ਚਿੱਠੀ ਲਿਖੀ ਆ, ਉਹਨਾਂ ਦਾ ਕੀ ਰਿਸਪੌਂਸ ਆ? ਔਰ ਉਹਨਾਂ ਨੇ ਗੱਲ ਘੁਮਾ ਫਰਾ ਕੇ ਜਿਹੜੀ ਦੱਸੀ ਆ, ਔਰ ਅਖੀਰ ਉਹਨਾਂ ਨੇ ਇਹੀ ਕਿਹਾ ਕਿ ਲਿਬਰਲ ਸਰਕਾਰ ਦਾ ਕਸੂਰ ਹੈ, ਉਹਨਾਂ ਨੇ ਇਸ ਤਰ੍ਹਾਂ ਕੀਤਾ, ਉਹਨਾਂ ਨੇ ਇਸ ਤਰ੍ਹਾਂ ਕੀਤਾ। ਉਹਨਾਂ ਨੇ ਕੋਈ ਸਿੱਧਾ ਜਵਾਬ ਨਹੀਂ ਦਿੱਤਾ, ਲੇਕਿਨ ਇਹਨਾਂ ਡਾਕਟਰਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਜਿਹੜੀਆਂ ਹਾਲਵੇ 'ਚ ਹੋ ਰਹੀਆਂ ਮੌਤਾਂ ਨੇ ਇਹ ਰੋਕੀਆਂ ਜਾ ਸਕਦੀਆਂ, ਪ੍ਰੀਵੈਂਟੇਬਲ ਨੇ ਇਹ। ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਮੈਂ ਉਹਨਾਂ ਨਾਲ ਗੱਲ ਕੀਤੀ ਸੀ ਕਿ ਵੈਨਕੂਵਰ ਦੀ ਪਾਪੂਲੇਸ਼ਨ 6,62,000 ਹੈ, ਉਹਨਾਂ ਕੋਲ 3,000 ਅਕਿਊਟ ਕੇਅਰ ਬੈੱਡਸ ਨੇ ਸਾਰੇ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ। ਸਾਡੀ ਜਿਹੜੀ ਪਾਪੂਲੇਸ਼ਨ ਹੈ ਉਹ 5,68,000 ਹੈ ਅਤੇ ਸਾਡੇ ਕੋਲ ਸਿਰਫ 634 ਬੈੱਡ ਨੇ। ਇਹ ਵਿਤਕਰਾ ਕਿਉਂ ਹੈ? ਔਰ ਫਿਰ ਮੈਂ ਉਹਨਾਂ ਨਾਲ ਫਿਰ ਗੱਲ ਕੀਤੀ ਸੀ ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ ਬਾਰੇ। ਫਿਰ ਉਹਨਾਂ ਨੇ ਤਾਰੀਫ ਕੀਤੀ 168 ਜਿਹੜਾ ਬੈਡਸ ਦਾ ਨਵਾਂ ਹਸਪਤਾਲ ਬਣਨਾ 3-4 ਸਾਲ ਬਾਅਦ ਕਲੋਵਰਡੇਲ। ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਫਿਰ ਬੇਨਤੀ ਕੀਤੀ ਕਿ ਘੱਟੋ ਘੱਟ ਉਹਦੇ ਵਿੱਚ ਮੈਟਰਨਿਟੀ ਵਾਰਡ ਤਾਂ ਐਂਟਰ ਕਰ ਦਿਓ, ਉਹ ਤਾਂ ਬਣਾ ਦਿਓ, ਤਾਂ ਕਿ ਇਹ ਜਿਹੜੇ ਬੱਚੇ ਨੇ ਇੱਥੇ ਸਰੀ ਦੇ ਵਿੱਚ ਸਭ ਤੋਂ ਵੱਧ ਬੱਚੇ ਪੈਦਾ ਹੋ ਰਹੇ ਨੇ BC 'ਚੋਂ। ਉਹ ਕਹਿੰਦੇ ਨਹੀਂ, ਉਹ ਬਹੁਤ ਵਧੀਆ ਅਤੇ ਉਹਦੇ 'ਚ ਕੈਂਸਰ ਵਾਰਡ ਹੋਵੇਗਾ। ਫਿਰ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਸੀ ਬਿੱਲ 36 ਦਾ ਉਹਨਾਂ ਨੇ ਪਾਸ ਕੀਤਾ ਕਿ ਕੀ ਕਰੇਗਾ, ਕਿ ਫੋਰਨ ਟ੍ਰੇਨ ਡਾਕਟਰਸ ਲਈ ਰਾਹ ਖੋਲ੍ਹੇਗਾ ਅਤੇ ਜਿਹੜੇ ਗੇਟਕੀਪਰ ਨੇ ਉਹਨਾਂ ਨੂੰ ਖ਼ਤਮ ਕਰੇਗਾ, ਜਾਂ ਕਿ ਤੁਸੀਂ ਡਾਕਟਰਾਂ ਦੇ ਉੱਤੇ ਗੈਗ ਆਰਡਰ ਲਾਉਣ ਲਈ ਕੀਤਾ। ਉਹ ਕਹਿੰਦੇ ਗੈਗ ਆਰਡਰ ਲਾਉਣ ਲਈ ਨਹੀਂ ਕੀਤਾ ਗਿਆ ਇਹ ਬਿੱਲ ਪਾਸ। ਫਿਰ ਅਖੀਰ 'ਚ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਬੇਨਤੀ ਕੀਤੀ ਕਿ ਡਾਕਟਰਾਂ ਨੂੰ ਤੁਸੀਂ ਮਿਲੋਗੇ, ਇਹਨਾਂ ਨੂੰ ਡਾਕਟਰਾਂ ਨਾਲ ਮੀਟਿੰਗ ਕਰੋ। ਮੈਂ ਇਹਨਾਂ ਨੂੰ ਇਹ ਵੀ ਦੱਸਿਆ ਕਿ ਕੱਲ੍ਹ ਜਿਹੜੇ ਸਵਾਲ ਪੁੱਛਣ ਗਈ 2 ਡਾਕਟਰਸ, ਇੱਕ ਤਾਂ ਜਿਹੜੀ ਐਮਰਜੈਂਸੀ ਵਾਰਡ ਦੇ ਜਿਹੜੇ ਡਾਇਰੈਕਟਰ ਸਨ, ਇੱਕ ਕਾਰਡੀਓਲੋਜੀ ਦੇ ਡਾਕਟਰ ਯੰਗ, ਉਹ ਡਾਇਰੈਕਟਰ ਸਨ ਕਾਰਡੀਓਲੋਜੀ ਡਿਪਾਰਟਮੈਂਟ ਦੇ ਹੈੱਡ। ਬਾਈ ਚਾਂਸ ਮੇਰੇ ਟੇਬਲ 'ਤੇ ਬੈਠੇ ਸੀ ਅਤੇ ਉਹ ਲਾਈਨ 'ਚ ਖੜ੍ਹੇ ਸਵਾਲ ਉਹਨਾਂ ਨੇ ਪੁੱਛੇ, ਲੇਕਿਨ ਏਡਰੀਅਨ ਡਿਕਸ ਸਾਹਿਬ ਨੇ ਕੋਈ ਸਿੱਧਾ ਜਵਾਬ ਨਹੀਂ ਦਿੱਤਾ ਉਹਨਾਂ ਦਾ, ਸਗੋਂ ਉਲਟਾ ਘੁਮਾ ਫਿਰਾ ਕੇ ਉਹ ਹੌਸਪੀਟਲ ਨਵੇਂ ਦੇ ਵਿੱਚ ਕੀ ਹੋਏਗਾ ਅਤੇ ਉਹ ਸਨ ਜਿਹੜੇ ਸਬਜ਼ ਬਾਗ ਸਨ ਉਹ ਵਿਖਾ ਦਿੱਤੇ। ਅਤੇ ਦੋਨੇ ਡਾਕਟਰ ਫਰਸਟਰੇਟ ਹੋਈਆਂ, ਮੇਰੇ ਟੇਬਲ 'ਤੇ ਆ ਕੇ ਬੈਠੀਆਂ, ਇੱਕ ਬਿਲਕੁਲ ਮੇਰੇ ਨਾਲ ਬੈਠੇ ਸਨ। ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਵੀ, ਫਿਰ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਕੈਥ ਲੈਬ ਬਾਰੇ ਵੀ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਗੱਲ ਕੀਤੀ ਸੀ। ਕੈਥ ਲੈਬ ਇੱਕ ਇਹ ਆ ਕਿ ਜਿਹੜੀ ਦਿਲ ਦਾ ਅੰਦਰਲੀ ਹਾਲਤ ਦੇਖ ਲੈਂਦੀ ਹੈ। ਬੋਸਟਨ ਬਾਰ ਤੋਂ ਲੈ ਕੇ ਚਲਾਵੈਕ ਅਤੇ ਸਾਰੇ ਐਬਸਫੋਰਡ ਤੋਂ ਲੈ ਕੇ ਸਰੀ ਤੱਕ ਇੱਕ ਵੀ ਹੈ ਨਹੀਂ ਗੀ ਉਹ ਕੈਥ ਲੈਬ ਜਿਹੜੀ ਆ। ਉਹ ਕਹਿੰਦੇ ਰੋਇਲ ਕੋਲੰਬੀਅਨ 'ਚ ਹੈਗੀ ਆ। ਰੋਇਲ ਕੋਲੰਬੀਅਨ ਤਾਂ ਹੋਰ ਬਹੁਤ ਕੁਛ ਹੈਗਾ ਜਿਹੜਾ ਸਾਡੇ ਕੋਲ ਹੈ ਨਹੀਂ। ਰੋਇਲ ਕੋਲੰਬੀਅਨ ਨਾਲ ਤਾਂ ਸਾਡਾ ਨਿੱਕੀ ਵੀ ਚੁੱਕ ਕੇ ਲੈ ਗਏ ਸਨ। ਰੋਇਲ ਕੋਲੰਬੀਅਨ ਦੇ ਵਿੱਚ ਜਿਹੜਾ ਹਾਰਟ ਦਾ ਸਟਰੋਕ ਦਾ ਇੰਤਜ਼ਾਮ ਬੈਟਰ ਹੈ ਸਾਡੇ ਨਾਲੋਂ। ਹਾਲੇ ਵੀ ਉਹ ਵਧਾਈ ਜਾ ਰਹੇ ਨੇ, ਉਹਨਾਂ ਦੇ ਬੈਡਸ ਹੋਰ ਵਧਾਈ ਜਾ ਰਹੇ ਨੇ। ਲੇਕਿਨ ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ ਦਾ ਕੀ ਕਰਨਾ? ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਫਿਰ ਅਖੀਰ 'ਚ ਇਹ ਵੀ ਕਿਹਾ ਕਿ ਮੈਂ ਤੁਹਾਡਾ ਧੰਨਵਾਦੀ ਹਾਂ, ਮੈਂ ਸਵਾਲ ਉਠਾਉਂਦਾ ਰਹਿਣਾ ਇਹ ਸਾਰੇ ਜਿਹੜੇ ਇਸ਼ੂਜ਼ ਨੇ, ਅਤੇ ਤੁਸੀਂ ਫਿਰ ਵੀ ਆ ਜਾਂਦੇ ਹੋ ਜਦੋਂ ਵੀ ਅਸੀਂ ਤੁਹਾਨੂੰ ਬੁਲਾਉਂਦੇ ਹਾਂ। ਸੋ ਕਹਿੰਦੇ ਮੈਂ ਸਰੀ ਨੂੰ ਪਿਆਰ ਕਰਦਾ, ਮੈਂ ਸਰੀ 'ਚ ਰਹਿਣਾ, ਮੈਂ ਸਰੀ ਦੇ ਲੋਕਾਂ ਨੂੰ ਮੁਹੱਬਤ ਕਰਦਾ। ਮੈਂ ਉਹਨਾਂ ਨੇ ਇਹ ਵੀ ਦੱਸ ਦਿੱਤਾ ਸੀ ਕਿ ਹੁਣ ਪੁਰਾਣੀ ਸਰਕਾਰ, ਲਿਬਰਲ ਸਰਕਾਰ ਨੇ ਨਹੀਂ ਪਰਫੋਰਮ ਕੀਤਾ, ਲੋਕਾਂ ਨੇ ਕੱਢ ਦਿੱਤੀ। ਤੁਸੀਂ ਹਾਲੇ ਵੀ ਉਹਦੀ ਗੱਲ ਕਰੀ ਜਾਂਦੇ ਹੋ, ਕਿੰਨਾ ਚਿਰ ਕਰੀ ਜਾਓਗੇ? ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਇਹ ਵੀ ਦੱਸਿਆ ਕਿ ਸਰੀ ਦੇ ਲੋਕਾਂ ਨੇ ਮੈਜੋਰਿਟੀ ਦਿੱਤੀ ਤੁਹਾਨੂੰ, ਔਰ ਅਖੀਰ ਦੇ ਵਿੱਚ ਉਹ ਕਹਿੰਦੇ ਕਿ ਚੇਂਜ ਲਿਆ ਰਹੇ ਹਾਂ, ਪਰ ਹੌਲੀ ਆ ਰਹੀ ਹੈ ਚੇਂਜ।